Hello everyone. Today I would like to talk about malaria. We can understand the disease malaria by following subheadings like introduction, mode of transmission, clinical features, your sign and symptom, and finally how we can prevent ourselves from getting the infection. This will be the conclusion part. Let's shift into the introduction part. First of all, you should know about the word malaria. What does it mean? It simply means mal-area. It means bad air. But the thing is, the disease malaria is a protozoan disease and caused by the infection with the parasite of Plasmodium and transmitted to men by certain species of infected female Anopheles mosquitoes. There are various species of Plasmodium like Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale and Plasmodium malariae. And the second part, we should know about how the disease transmits, the mode of transmission. As we all know that mosquito is a vector, that's why it's a vector-borne disease. And secondly, it can be congenital. It simply means it can transfer from a mother to a child through placenta during pregnancy. And thirdly, it is believed that somehow it can transmit through the blood transfusion. That's why the mode of transmission is firstly the vector transmission, secondly the congenital transmission, and thirdly through blood. Before switching to the sign and symptom, we should know about the incubation period. Incubation period is the time period between the infection enters the individual and the appearance of first sign and symptom. This is known as incubation period. And different plasmodium have different incubation period, varying from 1 week to several weeks also. Somehow it has been noticed that some strain of Plasmodium vivax may have incubation period up to 9 months. That's why it's very difficult to notice whether some individual is infected by the infection or not, because they will not have any clear sign and symptoms, but the thing is they can carry the infection. That's why if female Anopheles mosquito will bite the infected individual and the infection will go into the mosquito, and when the mosquito bites the healthier person, it can cause malaria. There are so many sign symptoms like fever, chills, body pain, normally back pain, and somehow we can notice that the fever will be in a cyclic movement. This can be a clinical features by which we can guess that there may be malaria. Next, coming to the investigation part. First of all the clinically suspected malaria cases need to be confirmed by the laboratory investigations like peripheral blood smear, malaria parasite test. Now coming to the preventive care. They mentioned that malaria can spread by the vector mosquito, so we need to control the mosquito to prevent ourselves from the mosquito bite, by means of which we can prevent ourselves from the malaria. So we need to minimize the production of mosquitoes starting from the eggs. Like we can destroy the eggs, we can minimize the growth. Even if the controlled measures the mosquito get developed, then we need to prevent ourselves from the mosquitoes. Like we can use the mosquito net, we can use some chemicals on the surface of our skin like Odomos, etc. There are some prophylaxis drugs used for malaria. Normally the drug used to treat malaria are used as the prophylaxis. As earlier I have already mentioned about the malaria transmission. Now we will try to discuss in short how the malaria transmits. We will see here in two ways, like through vector and another way is through congenital. First of all, the Plasmodium sporozoites enters into the first vector, the first mosquito, and the mosquito when bites the first human or the initial host. If she is a pregnant lady, then this infection can go to the baby. This is known as the congenital transmission. Otherwise, the infection will go directly to the liver. Inside the liver, the parasite gets the suitable environment for the growth. After the complete growth, it comes to the blood to infect the blood. When the parasite circulates throughout the blood, another vector, this is the second vector, another mosquito will bite the individual who is infected. Then the parasite will go into the mosquito, I mean the second vector. Then the second vector when bites the healthier individual, it will transmit the parasite into the healthier one. And this will continue from this, like from the initial host. The next human host then became the initial human host for another transmission. Likely it will go from one individual to another through the same cycle. Like the Plasmodium will go to the liver, otherwise it may go to the child through the in utero transmission. a congenital transmission. Otherwise it will go to the liver and again to the blood and again to the second vector and again to the next human host. Likewise malaria transmission cycle happens.